Today we are going to learn about the second session on wound management, that is fungating ulcer or cancer wound. So that will be taken by Sister Anna Rao. Most of you are familiar with Anna Rao. She was our last week faculty. Sister Anna, welcome back and over to you.
Good afternoon and thank you. So today, in continuation with last Monday's session, we will discuss on the fungating wounds. Madam, can we have the presentation, please?
Yeah, ma'am.
Thank you. So fungating wounds mainly we see in the advanced cancer patients. Okay, so let us first see the definition. Next slide, please. So mainly the definition goes like this, that it is a mass of malignant cells that have infiltrated the epithelial tissues of the skin and the surrounding blood and lymph vessels. Okay, so the cancer may be in the skin itself, or the cells might have migrated from the other side. Okay, and this is generally a complication of cancer, and it develops in the patients with advanced disease. And as I told, the cause is the direct infiltration of the skin, tissues, mucosa, underlying blood and lymph vessels by the tumor itself. Tumor might be developing from the skin or the metastatic deposit from the distant tumor anywhere in the body. Next slide, please. So, why is it important for us to take care of such wound? Okay, so generally speaking, about 5 to 15% of cancer patients develop this kind of wound. Yeah, and it is very traumatic. You can see here how it has developed in the uh, patient with cancer of breast on the chest itself. Okay, and it becomes very traumatic because it is a constant reminder of visual reminder. Okay, you can see the wound, patient will be seeing, relatives will be seeing. Okay, and it becomes a constant reminder of their own mortality as the cancer will infiltrate the skin and the surrounding tissues. They can be very painful. They will have lots of exudate. Many a times it causes bleeding also. The bleeding may be very superficial also, or if some major vessel is involved, then there can be massive bleeding also, and the exudate will be very much of foul odor. And without treatment, generally these wounds have potential to extend and cause massive damage to the wound site and to the body of the patient. And many of a time, it is observed that patient generally belonging to lower socioeconomic condition and staying in poor hygienic condition, they mainly land up in this type of wound complications because they mainly lack proper care and treatment, and also the hygienic part, plus the environmental conditions. So providing comfort to the patient becomes our prime objective in palliative care. Next slide, please. So what are the characteristics and where it is found? Okay, so it will look like fungal. appearance. It may be white, it may be other colors also. It will look like a crater. Okay, superficial surface will be very much wet. Okay, appearance will be of that of cauliflower. It will grow very rapidly, and it will ulcerate and proliferate, or even many a times fistulate also in just below to other organs. It will produce varying uh, physical symptoms, mainly including pain, high levels of exudate. Here there won't be slight exudate, but plenty of fluid will be coming out. We will be seeing why. Excessive bleeding may occur, and there will be malodor. Most common site of this fungating wound is the breast tumor, but it can be anywhere. Okay, generally seen in cancer of head and neck, soft tissue sarcomas, also tumor in kidney, bladder, lung, ovary, vagina, colon, penis. Okay, any part of the body involves this kind of extension on the skin. And the presentation is very much individual, uh, as we can see here in the neck cancer patient. Next slide, please. Okay, so this is the process of development. You see the fungating lesion. Okay, there will be we know that in cancer there is no limitation in the proliferation of the cells. Okay, they go out of control. Okay, so there here also there is rapid proliferation of cells, and they are so fast. In within few days you will see cauliflower appearance. Ulceration takes place here. Uh, the surrounding crater like boundary is found. Okay, and the margin always remain wet. Generally in acute condition of the ulcer, we if we have wet surface, it will help in healing. Okay, but here it is the opposite thing, because of the reaction of the chemicals that are produced in the cells, and you see the erosion of the tissues, sinuses. So it becomes very complicated wound. Next slide, please. Okay, so why other symptoms are seen like necrosis? So vascular deficiency, the cancer cells produce at the local level. Okay, so local tissues and cell level, it affects the blood flow. Okay, so there is poor cell perfusion that will cause hypoxic regions, and because of lack of oxygen and nutrients, the local cells will die and it will produce necrosis. So many a times we see a large part of such cells, and they are causing more and more exudate, and other infection also is attracting. Absence or abnormal lymphatic vessels that the tumor causes, it causes increased interstitial fluid. Okay, that will lead to increased extravascular pressure. Okay, and there will be subsequent collapse of blood vessels, and it will cause lot of fluid to come out. Okay, so that is what generally we call it as exudate. Next slide, please. So, because of the cell proliferation, the acidic pH of extracellular fluid, it will interfere with the clotting mechanism of the cell blood supply. Okay, and it will cause bleeding, and the tissues will be very much uh, non-healing type friable tissues, very tender, you can see. Moist necrosis will cause the colonization, and it will also attract infection. Secondary infection will take place. Okay, there will be many types of bacteria and all, aerobes and anaerobes. Okay, that will cause volatile fatty acids, breakup of volatile fatty acids, okay, and it will lead to malodor and more exudate. So these are the main problems that are seen in the fungating wounds. Next slide, please. Okay, so what to do? Uh, Naturally, it will be so big. You may see many pictures online. You might have seen patients also with that. Okay, so large wound, it becomes very much difficult to manage. Uh, Healing may not be possible. Okay, so our objective will be to provide maximum comfort to the patient. Okay, and the other signs and symptoms which are there, pain and malodor and all, those symptoms should be controlled. So symptom control becomes our main goal. And the assessment of the patient and the wound, and also take in the condition of the relatives. Okay, so whole assessment, all the four aspects of our holistic assessment should be taken care of, and the management should be guided by the problems which are we always ask patient what are his problems, because unless the patient tells us many times how to control, what to do, it becomes very difficult. And also encourage relatives, so the combined effort can be taken and maximum relief can be provided. So points we will like to keep in mind would be: wound is chronic in nature, okay, and it is very complex to manage. So plan in such a way, and of course, depending on patient's health and his condition, individual care plan should be planned. Okay, and treatment plan should be uh, including the significant amount of psychological and social support to the patient. That is the most important part, because if we try to solve, or we can help in that psychological and social manner, many a times patients physical symptom uh, and pain also lessens. Next slide, please. Why assessment on regular basis is needed? Okay, so importance of assessment, we know that it will help us to monitor the efficacy of treatment, whatever we are doing, how much it has improved, what are the patient's condition that has improved, and what else need to be done. Okay, so constant assessment and evaluation of our steps always help for the next course of action. If we are giving any kind of treatment, whether there are any side effects of it or not, that we can find out. Also, it provides an insight into patient's quality of care, and our quality of care, and plus the patient's, its effect on patient's quality of life. So holistic approach that takes account of whole person must always be remembered. It helps in the to us, that is professionals, to plan for next step in the care, so should be done carefully to maximize the effects of the care that is given by us. Plenty of steps might be taken to address the problems, okay, but if we are not doing it in right way, and if we are not evaluating it, then we cannot find out whether our treatment or our steps which are taken by us are going in the right direction or not. So that is why it is very much essential. Next slide, please. Okay, so I have put these two pictures on the screen. Okay, we will take 5 minutes to list, uh, do assessment from your side. that what problems you are finding. Okay, so and divide the problems of the patient under 4 headings. Okay, namely physical assessment. Next is psychological problems, social problems, and spiritual problems. So 4 components of our total pain assessment. Okay, so let's take 5 minutes to list down the problems. Then we will proceed further.
First, we can discuss about the physical problems. I think you can chat or speak.
Yes, okay. Physical assessment.
Yes.
Okay. QOL means quality of life.
Yes. Yeah.
Yes. Pain, bleeding.
Malodor.
Yes.
Exudate.
Yes.
Self-image. Maybe disfigurement.
Hmm. Okay.
Yes.
Psychosocial body image, right?
Physical problems unable to swallow due to pain.
Okay.
Infection,
Infection,
bleeding. Bleeding.
right?
Okay.
Yes. Unable to speak, right? Eat and chew, right? Very good. Yes. Food intake will be major problem. Bleeding, disturb body image, right? Low self-esteem, okay. Depression, that will go in psychological, okay. Right. Next, psychological problems other than depression, spiritual, yes. Why me? Yes. Okay. Sister, Shiva, sister, the picture on the left, no, Amma, that I had taken when I was doing CCPN with the patient's permission. So she
Oh.
allowed take picture.
Okay.
Okay, so we can very easily, uh, the best way I would say that if we want to visualize the problems suffered by the patient, is put our own feet in patient's shoes. Okay, imagine that you are at the in patient's place. So the automatically all the problems we can list very easily. It is very difficult, should not happen to anyone, God forbid, but anyone can land up in any problem anytime. We know the life is so uncertain. The many pictures when we see on the many of the pictures I have also taken from the net in this presentation, but when we go through those pictures they are so traumatized uh, by looking at it. So we can just imagine if it is there on our own body what would happen. Okay, so it is very much the psychological social trauma is too high in such patients. So to say anything, give this care, that care is very easy many times. But when the person is suffering, it is very difficult to address those things and solve also on patient side. Yes, stigma is also very much even now when the condition is going on like corona, okay, there is stigma. So imagine the person living in very rural area and having such wound on the body, how they must be going through. Okay, so we should always keep those things in mind and take care of the patients. Okay, so let us see all the problems one by one. Madam, next slide, please. I have tried to put up a few physical problems here. So we will do the assessment where the wound is. Okay, we know how to do assessment of the wound, right? Last time also we had seen many of the things. So here also many ready-made formats are also available. So either using that or the general what we know. So location and size of the wound should be seen. Then tissue type, what kind of tumor is it, uh, what kind of the wound bed is there, okay, what is the condition of the wound, okay, so that we will see. Exudate, what is the level, okay, and type, what kind of exudate is there, so that also can be examined. Then order, again the whether it is mild, what, that can be uh, then pain level, okay, including during dressing, okay, pain otherwise also is there, but many times patient suffers a lot of pain, experience lot of pain during the change of dressing, so that should be taken into account. Then it will be itching, okay, so pruritus of the wound or surrounding skin, because the exudate will be causing constant irritation on the crater, okay, so there the patient will having lot of itching. Condition of the surrounding skin, how it looks, okay, that. Then effects on the daily activities of living, whether patient is able to do his daily activity, okay, like the that amma was having wound on the face itself, okay, so how she will be able to do her oral care, okay, so like that problems. Plus how whether the patient is able to cook, may not be possible for herself, right? So general activity of living also will be affected. Yeah. So all those what are the limitations that we should try to find out. Frequency of dressing change required, okay, how often the change in dressing is required, and how comfortable it is, because many of the time the wound is so large that and we have while dressing we have to see that we cover all the part of the wound, okay, so the dressing really becomes very bulky because we have to put lot of pads so that it will soak the exudate, okay, because it will be coming in large amount, so the dressing becomes very bulky, and presence of secondary infection into the wound, okay, so all these parts all these problems should be taken into account when we are doing assessment. Next slide please. Psychological issues, okay, so body image, malodor from the fungating wound can make a patient feel like she or he is rotting away. Okay, the stench will be so strong that not only the patient, but in the room where the patient is, or even sometimes we can find out the patient is having fungating wound right from the door itself, entrance of the house itself, that some patient is having this problem, so much strong stench is there. So there is feeling of disgust on that changing appearance. Communication difficulties are there, okay, they are not able to open up about their problems. Cosmetic effect of dressing, social isolation, there would be rejection also, maybe from the patient's relative or the society in which the patient is living. uh, on patient's part, they will always now go into denial mode. Okay, and they will neglect themselves. They will go into depression. There will be a lot of agony of rejection and defeat, that they are defeated by some higher force. Patient may land up into depression. Patient is not I mean, coming out with real problems, difficulties, whatever is there in their mind. They will be very much embarrassed. There would be always fear, because the wound is constant reminder. When it is on the open body part, it is very disgusting and fearful. Sight itself would be very fearful. Feeling of guilt will be always there. Okay, all these things are very difficult to identify. And on patient's part, many times we try to ask them, how do you feel, how do you feel? But there would be so much inside their mind. Many times they are not coming out to tell us. So that are the main problems. Next slide, please.
Hello, sister.
Hello.
Yeah, yeah. Hello.
Hello, next slide, please.
Yeah. Okay.
Okay. Next is social issues. Okay, so impact on the spouse, immediate relatives. First, we'll see the spouse and other members of the family. If the small kids are there, they are not ready to go near the mother or father if any one of them is suffering with. Odor will permeate into surrounding environment, okay, making the task such as meal times, receiving visitors, okay, will become unachievable for many of the patients. Information on the needs of patients and family should be uh, asked by the healthcare worker. There may be restrictions due to dressing changes. Okay, then there may be feeling of disgust and revulsion is also there. Self uh, respect is lost, self esteem is lost, sexuality becomes in Indian scenario, hardly anyone asks about it or comes out. The patient brings it out during discussion. Patient is always feeling a sense of shame. Social isolation is there. Social support and resources are totally exhausted, and many times the patient is not working, but side by side, the person who is taking care of her or him also is not able to work. Okay, so the economical condition of the family uh, is going down day by day. If children are there, what about their education? Okay, so all these social issues are very delicate to deal with. Next, please. Uh, Spiritual issues. Taking Many times person takes it as punishment from God. If the person is having cancer of tongue, with he may have the worries whether I this was given by God because I did not worship properly, or I have committed some sin, I have spoken bad language. Okay, patients will have lot of uh, things going on in his mind. Why me? Somebody has listed in the uh, chat box also. So yes, that issue will be there. Patient will maybe angry at God that I did so good, I never did bad to others, then also I am suffering. Okay, so that part will be there. Rejection from the community. Community people may think that it is God's curse on the family or patient. and they are not allowed to take part in any kind of activities, not even in religious activities, then what? Patient may be feeling very aloof, okay, disconnected from the totally from the social life and from the God also. He may not be able to go to the religious places, okay. So far he was visiting every day to the religious place, maybe it may be temple or maybe church, but now it is not so. So slowly they lost faith in God, and to the end that they lose the purpose to live life itself. Okay, so this totally results in despair. Next slide, please. Okay, so our wound management will circle around these things. Okay, uh, all the problems we have tried on left, there are mainly physical problems are listed. Okay, and in general speaking, we can simply remember Hope's formula. Okay, so that also is a good way to uh, remember the points how to take care of the patient. So one by one we will discuss. Next slide, please. Yes, so wound management. Many times it is seen that anti-cancer treatment, like radiation therapy and chemotherapy, it helps in reducing the malignant wound, okay, or we can say here fungating wound. But side effects also should be discussed with the patient, okay, because both of them give quite a lot of side effects. So that can be discussed and then it can be started. But it do help. Then debridement and surgery to certain level may help in the management of the wound. Control of infection with help of systemic antibiotics is very essential. Uh, deep If the patient is having pain, so we have to assess the pain, what kind of pain it is, okay, and accordingly painkillers are given. I'm sure the topic might have been covered, so that can be dealt with. Okay, so whether it is aching pain, stabbing pain, whether it remains continuous. Okay, so in that way, adjustment of the analgesics can be done. Many times, if the patient is on morphine, then extra dose of morphine 30 minutes before dressing is given. Okay, so last time also we had discussed this. So that will be helpful in reducing the pain during the dressing changes. Superficial pain, burning or stinging type of pain can be taken care of with the help of local application of lignocaine jelly or spraying of the lignocaine. Okay, that can be done, or opioid, and never to take out dressing directly, but to soak it with the normal saline. Okay, so with that, the dressing material will come off very easily. Incidental pain is the one which is felt only on movement. Okay, so in that case, ketamine sublingual is given. Okay, so in this way, we can have the pain management. Next slide, please. Malodor, as we had seen, that it is mainly caused by the bacterial growth in the dead tissues. Okay, so daily bath before dressing is encouraged. This also helps in loosening the dressing material, and also the superficial dead tissues will be removed. Okay, so that's how it helps. Wound cleaning with isotonic saline. Okay, topical metronidazole is used. So what we generally do is that crush the tablets, keep it in the airtight container. Okay, and that can be sprayed over the wound. Okay, many times the IV metronidazole that comes in small bottles can also be used to irrigate the wound. Sometimes systemic metronidazole is given, but many times it gives other side effects also, like vomiting and nausea and all. So generally to treat our wounds in cancer setting, we use this crushed metronidazole tablets. Gel is also available, but the concentration of the drug in the gel is less than the tablet form. So tablet are more uh, beneficial. If the dressing is very painful, wound is very painful, then metrogel powder is mixed with the lignocaine jelly and applied over the wound, and then the dressing is done. Exudate is too high, so ideally the dressing should be done at least twice a day. For infection, we have to find out what is the cause of secondary infection, and then give the antimicrobial treatment. It may be in the form of topical or can be systemic. Odor control using dressings containing charcoal is also used. That helps. And surrounding odor in the room can be dealt with the help of maybe the room freshener, or like incense sticks, charcoal under the bed. That also gives good odor control of the surroundings of the patient. Next slide, please. Uh, Now taking care of the exudate. So it large amount of exudate, it causes lot of problems in daily life issues. Quality of life is affected by that. Okay, moderate or large quantity of exudate is found because of the increased permeability of the vessels within the tumor itself, or maybe because of the action of the bacterial enzymes. This we also saw in the pathophysiology in previous slides. If exudate is not controlled, then other problems along with it are very easy. Easily they spoil the scenario. Soiling of the clothes, peri-wound maceration will be there because the skin will be always wet because of large amount of exudate. Okay, so there may be leakage out of the dressing material, and uh, then odor also will not be effectively managed. So control of exudate is also essential. Many times good dressing material helps. So selection of dressing material should be done very wisely, so that these problems are avoided. Nowadays many things are available, like foams are there which will absorb large amount. Then alginates is also there. Hydrofibers are also there. Okay, these things will uh, absorb large amount of the liquid which is coming out of the wound. Uh, some of the technologies that are based on diaper technology are also used, so that also helps in absorption. Treating infection with antibiotics is must, then only the problem can be lessened. Using antimicrobial dressing like those containing honey, silver or iodine also help. Uh, and frequent change, at least twice a day, is must. Next slide, please. So care of surrounding skin also is essential. So for that, barrier film products are useful because the skin becomes very fragile, and slightest trauma will cause it a uh, in problem of infection very easily, and the condition will deteriorate very fast. So minimize skin contact with exudate is essential. Protect with suitable barrier cream or film. Many times zinc containing ointments are also available, so that also can be used. Use dressing with increased fluid handling capacity so that it will not affect the surrounding skin. Palliative radiotherapy, as we discussed before, also helps in reducing the exudate. But as we discussed before, side effects also should be taken care of. Next slide, please. Here I have given some of the uh, antimicrobial agents and their benefits. Okay, so foams will promote moist wound environment and does not adhere to the tissue. So it helps. It also prevents the strike through. Okay, so the wound will not progress further, or the surrounding skin will not be affected. Shapes and sizes are also available, so it helps in dressing. Calcium alginates are there, which are used to cover or fill the wound bed, and it becomes gel and it absorbs the drainage. Okay, so yeah, it keeps some moist, but large amount is absorbed. It may act as hemostatic agent also, so prevents bleeding. Then honey, it has high osmolarity and low water activity, so it keeps the dry area. Bactericidal effect is also there, and it moistens wound and removes necrotic tissue. It also lowers wound pH so that further wound healing is promoted. Silver helps in gradual, I mean, it has bactericidal effects also, and also it helps in controlling odor. Next slide, please. Charcoal, we know that it absorbs gas and bacterial spores, so uh, it helps in odor control. Dakin solution, it helps in broad spectrum bactericidal effects, promotes resolution of necrotic tissue also, and requires dressing changes twice a day. Metronidazole helps in bactericidal effect, and it is effective against anaerobes. Next slide, please. Next is bleeding. When we are changing dressing, and many times small bleeders are there, they open up and slight bleeding takes place. Okay, so what to do at that time? Here we can press with help of gauze. Okay, so local pressure should be given for 10 minutes. Uh, and even then, after 10 minutes, it continues, then we may keep the pressure for longer time. Okay. Uh, Treatment for the local infection should be uh, done, and topical sucralfate powder is used. Okay, it forms coating, so that can prevent further bleeding. Systemic ethamsulate and tranexamic acid is also used. Uh, this also such tablets also can be crushed and sprinkled over the uh, bleeding area that will control bleeding. Many times adrenaline packs are also used, but they should be used with caution because it will get absorbed in the local tissues, okay, and it can cause elevation of the blood pressure, and so it can further start bleeding, okay, or more bleeding can take place. If we can't stop, then immediate surgical intervention should be done because we don't want patient to lose large amount of blood. Many times, if very deep large vessels are affected by the wound itself, then lot of blood can come out of the wound. Okay, and patient can have even shock also. So in such cases, we have to be very careful. Use of dark colored clothes is very essential because if the clothes are light colored, then with the sight itself, the patient and the surrounding people will go uh, into problems. So we don't want that. So use of uh, dark clothes are also advisable. Next slide, please. Teaching of caregiver is very, very essential. Uh, how to prepare homemade saline that I have given here. And last time also we had discussed these 2 points, how to prepare their own dressing material and how to store them, what to do. So such things should be taught to the caretaker because many patients are very brave also. They do their dressing themselves, but after certain point of time it may not be possible. So we should always teach the close relative to take care how to do dressing of the wound. That is very important so that we can prevent patient coming and going to hospital and save their money for some more important things. So they should never forget of washing hands before and after dressing, use of dark colored clothes, cleaning of bleeding wounds, how to do, where to dispose of waste material, okay, and regular follow-up with the healthcare team. At least telephonic follow-up is also essential. So this much for the physical problems. Next slide, please. Uh, what to do when the maggots are there? Okay, maggots create a lot of problem because you can imagine those crawling things on the body. Okay, how we feel. So they should never develop maggots in the wound. Most important thing is as soon as you see such patients with the uh, fungating wounds, advise them to be in the net 24 hours. Okay, so why so? Because the flying flies, house flies, they are easily attracted to the exudates and the smell. Okay, and they will lay their eggs in the wound, and that the larva will be hatched from the eggs, and maggots will be created. Okay, so that problem should never occur in the patient. You can help preventing by regular cleaning and dressing of the wound uh, is essential. Locally, keep the swab soaked with turpentine, and so that there will not be any oxygen for the larva. Okay, and they will come out because of asphyxiation, and you can pick them up. with the help of thumb forceps. We should not follow the maggots into the wounds, okay, or you will injure the patient. Repeat it every 3 to 4 days. Teach the carer the correct way of dressing. Okay, and there should not be any gaps remaining in the when we are covering the wound. Okay, because from there the problem will start. So this care should be done. Next slide, please. Okay, here I have shown in the leg, but the maggots can be anywhere, wherever the wound is. Okay, so that should be a very horrible situation scenario for the patient and for the caregiver, for us also. Local application, other things are also used instead of this mineral oil, ether, chloroform, ethyl chloride, mercury chloride, creosote, saline, phenol, calomel, then olive oil, iodoform. Okay, so manual removal after that, this can be applied. So they will help further uh, because of lack of the oxygen, they will come out. Surgical debridement will also help for the purpose. And in one research study, I read this, the systemic use of ivermectin, albendazole, and clindamycin. They call it triple therapy. So with that, they had produced very good result in the patients with maggots. So this therapy is also there. Next slide, please. Taking care of psychological issues. Okay, how to do? Mainly counseling and coping mechanisms can be taught to the patient. Regular visits by the team, healthcare team, to identify the problems and how to help them, in what way. Keep the part covered, so that will cause mainly the psychological trauma of the site can be dealt with. Wearing of dark colored clothes so that you can hide the blood. Drugs to reduce anxiety and depression. So constant evaluation will help in identifying the problems, whether patient is undergoing any anxiety or depression, and the drug management can be given. Next slide, please. Uh, Social needs identification again, counseling of family members, involvement of social worker for identification of the needs, support from NGO, government support system, if we should be aware of it, and how the patient's relative can avail them. That is must for us, like getting a ration card for them or BPL card for the uh, patient, so that they can have at least good food that can be uh, uh, made available to them. Next slide, please. Here also in spiritual needs, again counseling, best way is many times we feel very, I mean, not able to deal with the spiritual issues. So with the help of relatives, we can rope in the religious leaders. They are happy to help the patients and the needy. Breaking the barrier among the close relatives is must. Then the last days of the patient can be at least at peace, uh, at mind, and attending the wishes of the patient, that should be done. Next slide, please. So with this positive things in mind, uh, I would end my presentation. All these 5 points all must remember. Thank you very much.
Thank you, Sister Anna, for
Presentation.
the
It is great to be part of Pallium always. I love to, take part in activities. Many times, last full week I was sick. Uh, my throat was not in good position, so I was wondering whether I will be able to give today's lecture. But with grace of God and with your best wishes, I could speak today.
Okay, thank you, Sister Anna, for the excellent presentation. So, any doubts you can ask now. Either you can chat or you can speak. So one question, Anna, what kind of honey, the commercial type of honey, sell it in supermarket? Question.
I have just read, madam. Actually, I have no experience of using honey, but it helps because it gives the layer is there. It removes the dead tissues. That's what I have known. So, actual practical experience, I don't have.
Even we don't know, we don't have any experience on honey treatment, but it can be helpful. The literature says that it can be helpful to control of bacterial growth and prevent slough formation and all. So how to apply charcoal on dressing?
Uh, I think last time we had that one sister had explained that a thin dressing is kept, and over that charcoal is sprinkled, not directly on the wound, but it absorbs the gas molecules. Honey has anti-inflammatory properties, so uh, that's how it promotes rapid healing. That's what they say. I have heard that charcoal ready-made dressing is also available, film-like, which can be applied.
So one of them are experienced with ordinary honey. So Rose, Sister Rosma.
Okay.
Rosma, yeah, can you unmute and speak?
Okay, for the honey dressing, I experienced when I was at physical.
Can you speak a little more louder? We are not able to hear you clearly.
Can you hear me? Can you hear me or not?
A little more louder. Yes, we can hear you.
Hello, can you hear me or not?
Yes,
Yes.
Now can you hear me?
Yes, we can hear you.
Okay, I experienced before when I was in surgical team. So what we did is the same like what how we do the charcoal dressing. After we clean everything, we can apply any honey, any type of honey. But I think nowadays people a lot of a kind of honey. But what we used before is a honey from bee. But we cannot put it too many. So what we do is just a very, very little. Remember last time I told that the charcoal, we cannot put it directly, but the honey, yes, you can.
Okay, thank you. Any other questions? Sister Regina? Sister Regina, you have raised your hands. Do you have anything
Good
to
morning.
Good morning,
Good
ma'am.
morning. Please, I wanted to ask, with the wound dressing, yes, I was asking whether we can use povidone iodine as part of the agents, like as one of the things that we use, because she mentioned that you can use charcoal, you can apply honey, and many other things. So I was also asking whether we can use povidone iodine. In Ghana, we have that. It's very common here. We use it. So I wanted to know whether you can use that one to dress that kind of wound. Hello.
Povidone iodine many times it destroys the good tissues also. So generally, here also, I mean, for even general wound, after certain, I mean, they don't apply it for a very long period of time. So for fungating wound also, I have heard that it should not be applied. Like uh,
All
Sister
right,
Shiv.
ma'am.
Yeah, that hypochlorite solution like povidone iodine solution and hydrogen peroxide that will destroy the granulation tissues. Literature says that's why we are not encouraging povidone iodine solution in the palliative care settings.
Oh, okay. Okay. Okay, good to know. Thank you so much.
I have one question. So I need I expect the answer from the participants. So what are the difference between the cancer wound and bed sore? So last week we learned about pressure ulcer. Today we learned about fungating ulcer. So what are the difference, major difference between this? Anybody? Regina. Sister Regina?
Yes, ma'am.
Yeah.
Okay, I think that the difference here is that mainly the pressure ulcers are developed as a result of pressure or excessive heat. Like ma'am explained to us last week, if the patient lies at one particular place for a longer period, considering the heat and the pressure that and the friction that occurs between the body, the skin, and the bed or whatever the patient is lying on, that friction most of the time causes the ulcers, and then it happens on the mostly on the bony prominences of the body, like the elbow, the ankle, the buttocks, and all those places. But with the fungating ulcers that we are learning today, I think that from my own understanding, I think it can happen at any part of the body. First of all, it can happen on any part of the body. It doesn't necessarily have to happen on the bony surfaces, but it can happen on any place on the human body. And it also doesn't have to have a kind of friction or pressure being applied to the skin before the
Sister Regina, we lost you.
can come on. It can as a result of the disease progression, like as the disease
Sister Regina, we can't hear you. Okay, the chat answer is bed sore is preventable. And any other answers? Okay, the major difference between pressure ulcer and cancer ulcer is pressure ulcer is preventable and curable. So the cancer ulcer is not preventable and not curable. So this is the major difference between these two types of wounds. So when we see these type of patients, this is not curable. The cancer wound is not curable. So that psychological problems, emotional, spiritual problems will be more about this type of patients. So when we talk to these type of patients, you can try to talk to them individually. Then only you can get a good assessment. So if you, Sister Regina. So as sister said, the cancer wound will be proliferating out. So and ulceration is also ulceration and proliferation take place. So there are lot of physical problems. So we have discussed many things today. Pain. So these patients may experience two different types of pain. So we discussed on pain session, nociceptive pain and neuropathic pain. So only maybe because of pressing on that proliferative tissues or pressing on the nerves, that time the patient experienced neuropathic pain. And direct exposure of the dermis, that can cause the painful ulceration can cause nociceptive pain. This can be relieved by systemic the analgesics, and you can apply local analgesics for that. So if there is a neuropathic pain there, you can apply local analgesics like lignocaine or sensorcaine. And Exudate. Exudate is the next major symptom. So it can cause increased permeability of the blood vessels within the tumor. So that can cause the tumor, the vascular fracture is formed within the tumor. That leads to severe exudate will come out. So that management what we already discussed, we can and another cause is inflammation. If there is an inflammation there is a chance of the lot of exudate. So these are the two causes the patients will develop exudate. And another cause, malodor. Malodor is also so the main cause is anaerobic bacterial infection, but the another side, stale exudates dressings have been more than number of days, that can cause malodor. So it can be prevented with the you can do proper dressing, and you can apply charcoal the charcoal powder dressings, and charcoal dressings are also available. You can and otherwise you can keep 1 or 2 pieces of charcoal in the room that will absorb the bad smell. And the combating odor like eucalyptus odor or coffee powder, that will absorb the, that will help to give a good smell. And usually patients complaining of nausea because of the bad smell, malodor. So that time literature says that the burnt flame that will absorb the bad smell. So you can try those things. And again, bleeding. Uh, usually dressings are adherents to the wound. So before your soak properly, you can try to remove the dressings. There is a chance of bleeding and pain. So always you can try to remove the dressings after soaking of dressing. So that we discussed earlier. And okay, so come to the maggots part. Our sister said, you can, if there is a proper health education is very, very important for this patient. Maggots can cause from, it can cause from flies. So they can always cover proper dressings, and covering of wound is essential. If there is a maggots there, there is only way to physical removal. And don't follow maggots. You can apply turpentine oil. You can soak turpentine oil with the into the gauze piece and keep close to the wound, and that will help to come out of the maggots. That you can take it out with the help of artery forceps. Physical removal is only way to remove the maggots. And the important message is, don't follow maggots. If you go through your when you go with your the artery forceps, the maggots, usually the maggots will come out with the nails, with the head. But when you go with your artery forceps, they go inside. So if you that follow that maggots, your artery forceps will damage the blood vessels. Okay, so you don't follow maggots. That is the important message when we take care of maggots. So we can move on to the case presentation.
Sister Nurisha, can you unmute yourself and speak?
Yes. Good afternoon, everyone. I'm Noraisha Shahmat from Malaysia, National Cancer Society of Malaysia, Sarawak branch. Can you hear me?
Yes, we can hear you.
Okay. So next slide, please. My patient is a female, 73 years old, diagnosed with triple negative invasive ductal cancer, left breast with lung mets. Next slide. Her main complaint was she was unable to walk. She had a very foul smell wound, pain at the tumor site and her lower back, numbness and weakness, both lower limb, tumor fungating and bleeding on the dressing. And she did her dressing herself and sometime at the clinic. So I divided the complaint from the patient and the carer. So the carer is the sister. The patient herself was 73. So the carer was 69 years old. They are elderly and she is caring for the grandchildren also. The carer wanted the sister to be admitted as she herself cannot cope. Next slide. History of her illness. She's single, nulliparous lady, diagnosed to have the triple negative left breast, lung with meds since February 2015. She was referred to hospice care on the 14th of March 2018. Our first visit was done on the 16th, 2 days later. She was under our care for 30 days and she passed away at home on the 15th of April 2018. Next slide, please. On examination, when we first saw her, she was alert but a bit pale. Her pulse volume was good. She was ambulating until 2 weeks ago, unable to walk, but she's like dragging herself on the floor with we call it bottom shuffle. Complaining of back pain, 2 weeks, radiating to her right lower limb, no history of fall or trauma, bottom shuffle to toilet to pee and passive motion, no incontinence. Denied any short of breath, no cough, no change in bowel habits. Her normal bowels is 1 or 2 days once. She also having difficulty to have a regular morphine 2 hourly, and then her pain ranging from 5/10 to 8/10 on the pain score. Next slide, please. This is her wound. But actually on our first visit, patient, she doesn't want us to do or even touch the dressing. So this picture was taken, I think, on the third visit. Next slide, please. So her treatment and the significant investigation. She received, all these are the from the chemo RTU center, 3 cycle of palliative chemo and another second line of chemo, but the tumor was still growing larger and bleeds. She was treated with palliative RT and then follow up at the RTU clinic. And then she received another radiotherapy for the left tumor because it was bleeding. Next slide. So this is just, sorry for my genogram, I just don't know how to make it nicer. So the one in X are all, so these, the patient have 10 siblings, and then now she's living with the sister. She's single, so she's living with the sister, age 69 years old, and then with 2 children at the same house. I will explain more the psychosocial aspect in my summary slide. Next. So at first, her medication, when we first visited her, she's on tranexamic acid 508 hourly, syrup lactulose 15 ml on night, paracetamol 1 gram 6 hourly, aqueous morphine 10 mg 4 hourly, tab-flagyl 800 mg for dressing. So this one, they need to crush it before they can put it on the dressing. Subsequently, we changed her medication to tab GABA. We add on some tab gabapentin for the nerve pain, 300 mg 12 hourly. Aqueous morphine, we increase 15 mg 6 hourly. The tranexamic lactulose, and because of her small size, our palliative doctor have reduced the paracetamol from 1 gram to 500 milligram 6 hourly. Next slide. Our main concern for the patient is she was having pain and numbness on her both leg and the wound area, worsening left upper and lower back. Patient refused help to do her dressing, denied any false smell and bleeding. But actually, when we first go in, when on our first visit, you can smell the wound even from the main door, and she was at the back of the room. She refuses diapers and she still wants to be independent. She refused admission as she claimed that no one will take care of her at the hospital. She lived with her sister, who also taking care of her grandchildren and her elderly husband. Patient claim still can ambulate and now unable to walk since 1 week. Next slide. So this 72 years old lady lives with her 69 years old sister, and she was not keen to be admitted. She wanted to be with her family, but the sister thinks it's better for her to be admitted as she was tired, taking care of the grandchildren, and want the sister to be kept properly in the hospital. Patient was depressed, having body image issues, refuses us and the sister to help her with the dressing. The sister and the husband took the opportunity to assess about their own illness whenever we go there, and they were not focusing to care for the patient. And we never really met any other relative around. Met some call to the younger sister daughter and explained to her that auntie doesn't want to be admitted and the parent need help. And also we noted that the patient was non-compliant to medication. Next slide. So 2 weeks later, the patient was weaker. So only now that she allowed us to do the dressing for her. She's using diapers, but she still wants to go to the toilet to pass motion. And I think after that, we did manage to meet the niece and explain to her that the mother can only take care of the children. She is scared to see the wound. And the niece said, actually now noontime and nighttime, they will come to help change the dressing. 1 week before she passed on, she was hallucinating. Dressing by now, we asked them to add the charcoal dressing, and we also teach them to clean the wound with green tea water. And also we did standby some adrenaline solution for packing in case of bleeding. So this picture is a sample of the charcoal dressing that we use for the patient. Next slide. Actually my slides are simple, and I think I'm at the end of my presentation. I would like to discuss about how can we help her to improve her quality of life, and then in what way can we offer help and support to her and her family as she refuses admission, and what type of dressing would you use for her bleeding and fungating dressing, and easy to apply when she was refusing help that time. Thank you.
Thank you, Sister Norusha, for the presentation. So if there is any clarification need, please ask. Otherwise, we can move on to the discussion points. How can we help her to improve her quality of life? We need answer from the, we can discuss these questions from the participation side. So we can discuss together. How can we help? Okay, Sister Regina, you can.
Hello. Please, I'm not clear with the dressing with green tea water. I don't know much about it. Can you explain further?
For green tea, you know the green tea that we drink. So you just what do you call it? Soak it with water, boil water, warm it, and then you can wash it. Like after you wash it, how do I explain it? You just clean the wound with the green tea water. Because it will help to, actually it helps to reduce the odor.
Okay.
Does it answer your question?
Because of the foul smell, you can clean with green tea water, right, sister?
Yes. Yes.
Okay. We learned many things today, so we can discuss how can we help her to improve her quality of life. So pain management and dressings, psychological support. Sister Anna, over to you. You can lead.
Sister, you are muted. Can you unmute from your end and speak?
Yeah, green tea also has antioxidant and anti-inflammatory properties. So I think that's why we drink also. So same way it must be helping in dressing the wound, and it must be absorbing the smell. So smell management is must. We had a similar type of patient in our home care setting 1 year back, and the dressing almost like similar photo I what we saw here. Same type. Half of her chest was in the wound. I mean, wound had covered that much of part. So the whole chest, like just garments, bandage was done. For such patients, psychological trauma is also a lot uh, because of the sight, and covering also becomes very much problematic because the dressing becomes very bulky. So when we are putting dressing, we also have to put in such a way that it not only covers the wound, but how to support the dressing is also a problem. So the garments which are there, like the wearing of what we wear, blouse type of thing, no? So that what can be worn for the support of the uh, dressing, that is very essential, because just with the bandage if we go on tying, it will come off many times. It will, gets loosened, and the wound becomes open. So garments which are worn by the patient also should support, so it will not only hold the uh, bandage in place, but it will shape the part also. So that is one thing. Counseling is a major issue here again, because she cannot, as a lady, she must be a very, uh, I mean, feeling of disgusting thing. So counseling, and maybe some prayer meeting and like that can be arranged for her spiritual needs. Whatever her wish can be fulfilled, because she also must be knowing and others in family members, and her sister is keeping her. That's a good sign that they are supporting, but they also must be having their own limitations, as it is said that during their uh, illness they are not able to take care of patient.
We
But
do.
staying in family of course gives a mental satisfaction.
It was hard at first because we didn't get to meet any of the other family member. But then I asked the sister if I could contact the daughter, and then they did give us the number. And after that, then only everybody was there to help them at home, and even the children. They help to get the children. At least most of the time, they bring it somewhere else. It was just a short. Lucky it was short notice, about short term, like 30 days under us. But I think before that, the carer and the sister herself was, they were very tired actually when we came. Mm.
So here the first question is how can we help her to improve the quality of life? So our aim is to palliative care aim is to improve the quality of life of the patient and their family. So in this case, I think if you if you want to improve the quality of life, you can try to reduce the symptoms. Okay, or palliation of symptoms. If there is a pain there, you can try to reduce the pain. If there is an exudate there, you can try to reduce that. And if there is a bleeding there, you can try to prevent bleeding. And if there is a and malodor there, you can prevent malodor. So that way, that little bit the physical symptoms will the subside, and then we can we can move on that psychological parts, social parts, and spiritual parts. So once the physical symptoms is controlled, we can able to take care of that another part. So that is why we manage it here. Maximum we try to control their physical symptoms first, and then we move on to the psychological part. So you can imagine psychological altered body image is also one of the major psychological problem. And anxiety, sometimes the patients day by day the growth will be proliferating, not that decreasing the size of the tumor, that will increasing the size day by day, that will that the patients will go to the anxiety and depression. So you can imagine if there is a one pimple in your face, that size will little bit increase. If you get a chance to see in front of mirror, how many times you go there and see your face? Is it increasing? Is it decreasing? Is there is any color change? That time, so you can imagine from the patient side, the wound size will be growing fast, and bad smell. Nobody is willing to take care of this type of patients. Severe exudate, bleeding, pain, and all. So that time. So definitely these patients will suffer four aspects. Why? Finally, the patients goes to the spiritual problem also. Why me? The God punished me like this. Something like that. So we can control as much as possible. We can control their physical problems, and that a way we can talk to the family members. We can give some psychological support and social support and spiritual support also. Can we move on to the second question? In what way we can offer help and support to her family? There is a small explanation on how to apply green tea on the wound for controlling of smell. There is a chat. So I don't have any experience on that. Okay. Okay, we can discuss the next question. In what way we can offer help and support to her and her family? I think last week we have discussed this type of problems. Is it correct, Sister Anna?
Yes, we had discussed. I mean, uh, physical. What family members are going through. Caretakers' agony also should be taken care of, like relieving them by some other person for few days. so that they can also have their own family life. If the economical problems are there, then accordingly, I mean, whatever is available in that, it will depend on the region, also in the country also, like what we have here for poor patients, like ration can be provided, in other countries also it must be there. So children's education can be done. Mainly the caretakers should be freed for some time from that care, because they are also in constant contact with the patient, and they also get uh, tired and burn out, we say it. So to relieve them is also one great thing. So maybe other family members can take turn, or the neighbors can help out. Society, community level is helping at community level is must. We can rope in the gram panchayat or like that. So they try to come and help. Regular visits from palliative care team also will help. Social worker can be involved in identifying problems.
Certain. Sister. So we have Sister Aina with us. She is a nurse. She's a project. She is working as a project officer here. So she wants to say something.
So in the question, in what way we can offer help and support to her and the family? I will suggest one more thing. It will be good if you ask how the family member feels, like how it is, how they are caring, and how it is is it okay for them, all these things. So sometimes when we talk with them, they will feel very happy, and half of their problems might go. So even a good communication with the family members will reduce their burden. We have lot many experience like this too. So thank you.
So, and another thing, we have to make sure that ensure about the any misconception about the disease. Sometimes, if there is a misconception into the family, so sometimes they are reluctant to take care of this type of patients, maybe spreading of disease. So we need to, when we assess, that is what I said earlier. We have to take assessment as individual. So if you do the individual assessment, we can assess, you can get those things. So otherwise, sometimes what my experience was, when they come with the family, they don't tell anything. Okay, so if you ask who will take care of this wound, then sometimes the mother or the father take care of the wound themselves or herself. But when with the family, they said, oh, she will take care of. Okay, so that if you do assessment individually, you can get that answers clearly. Okay, then based on the assessment, you can talk to the family and encourage the family. You can talk to the family, the caregivers about the any, if there is any misconception there, you can talk to them and convey that message also. Okay, and the third question, we already discussed what type of dressings you would use for her bleeding and fungating dressings. We already discussed. If there is a bleeding there, we can try to prevent. If there is a chance of bleeding, it's a huge fungating ulcer there, we can prevent bleeding. And if there is a bleeding there, we can apply sucralfate powder and tranexamic acid also, and adrenaline packs. We already, in these patients, adrenaline packs they used. But if we use adrenaline packs, that would be good. But there is a chance of rebound bleeding. Once the action is gone, there is a chance of rebound bleeding there. So we can in palliative care, we encourage sucralfate powder that will that mechanism behind that is that will induction of prostaglandins and promote clotting effect that will control bleeding. That is why we encourage sucralfate for controlling of bleeding in palliative care. But if bleeding is not controlled, you can go on the systemic ethamsalate, and you can go you can send the patient if there is a chance to reduce the if the tumor size is increasing, there is a chance of bleeding. So if you give one course of radiotherapy there, that will strengthen the size of tumor. That will help to strengthen the size of the tumor. So if there is a chance there, you can refer the patient to the oncologist and see if there is any chance there. You can try to do one course of radiotherapy for that. That is why we manage bleeding, that fungating ulcer, prevention of bleeding in this type of patient. Sister Anna, anything you want to add? Sister, we can't hear you.
No, what you said regarding the breaking the ice, no, that is very essential among the caregivers, because many times they feel that cancer is also an infective disease, and they don't I mean, the very close relative, if husband is there, is patient, then wife won't do the dressing. That scenario is seen here also. So that misconception has to be removed from the public. Many times they don't believe also. They said that because these medical people, they don't want to do dressing, or they don't come want us to come here. That is why, because it will consume lot of time to dress a fungating wound. It takes lot of time. So many times relatives are also not ready, and because of other problems, so they avoid touching and all, and plus this misconception, so the patient can have really a tough time. And for females, many few will come forward to help her. That is another scenario in India. So, and if the fungating wound is at this kind of place, then the whole image is lost, and how much psychological trauma she must be suffering. So we have to try maximum to reduce all the physical trauma and put her at psychological peace. That is very essential. Thank you.
Can I just say something?
Yes,
So
yes.
actually, on the second visit, we did talk to the patient herself, and we did ask the sister, how does she feel? Does she know about the sister condition? And then she did say she was scared. She knows it because of the smell, but the patient never really shot the dressing the wound to the sister, but from the smell and everything else, the younger sister knows it is very bad. And when I explored that, that's how I just said, maybe you should give me your children numbers, or at least if you are not there to help, maybe we could ask your, because patient herself, we tried our best to admit her. We wanted to help her because in our setting for now, we don't have any volunteer to help yet. We that time we are still new and we don't have more help. We tried and told her if you would want to be admitted, but she really don't want. So when I managed to call the niece, that's when she said, we will, yeah, because towards the end she was weaker, she can't do it herself, but the dressing need to be changed. So finally she did ask them to help her. but yeah, it was a bit too late lah. I wish that they had referred her to us earlier. Also, it was just a 30 days that it is just too fast. And I do hope that it was referred to us earlier so that at least we can improve more on her quality of life, because she was just lying there in the room, alone in the room, lying down, everything she does in the room, eating, but her room is connected to a toilet. There was at least it was not that they still clean up for her and everything else. It's just that she herself, the patient, doesn't want them, because she thinks that she don't want to like burden them, because she's single. There's she's not she didn't contribute anything to the family, and she don't want to be a burden, but at the same time she was scared to be admitted, because she thinks that if she's admitted, there's no one to take care of her, no one will come and visit her in the hospital. So it was just a sad case that I still remember until now.
Thank you. We can wind it here. So thank you, Sister Anna, for the excellent presentation. Thank you, Sister Norusha, for that presentation for the today's class. So thank you all for the interactions and all. Thank you once again, Sister Anna.
Thank you, ma'am. Thank you very much for giving me a good chance.